A big hello to all of you. This presentation is about diagnostic and remedial teaching in mathematics, and here we shall discuss what role does diagnostic tests play in providing the remedial teaching to the pupils and students, especially in the subject of mathematics teaching. As the name, the remedial teaching is the strategy to remove the weakness of the learner, and the diagnostic tests lead to remedial teaching, in which quality instructions material is prepared for quality learning, adapting different methodologies as per the needs of the individuals or a particular group. So, we can say the main purpose of diagnostic testing is to spot the learning difficulties of pupils with a view to develop corrective measures, and this is termed as remedial teaching. So, what is a diagnostic test and how shall it be performed? The main aim of diagnostic evaluation is to determine the causes of learning problems and to formulate a plan for remedial teaching. Thorndike says that a test that is sharply focused on some specific aspect of a skill or some specific cause of difficulty in acquiring a skill and that is useful in suggesting specific remedial actions that might help to improve mastery of that skill is a diagnostic test. So, a diagnostic test is a useful tool for analyzing difficulties, but it is should be used along with the information that we get from physical, intellectual, social, and emotional aspect of the pupil. This is also needed before an effective remedial program can be initiated. So, you can see in the diagram the various stages and steps to conduct the diagnostic test. We need to find out who are the pupils who need help, where are the errors located, weak points located, and why these weaknesses are there, why did the error occur. So this shall be keep in mind, and you can see all these essential steps right from the identification of the students, identifying the students who really are in trouble, who need help. So first one must know the learners who require help, and for this we can conduct a general achievement test based on the various mathematics topics which are already taught to the class, and after evaluation a teacher will be in a position to make list of the students who are below average, average, or above average, and next one has to locate the area. Now the various topics are concerned in mathematics, you can take the achievement test of different topics, and this is how you will come to know that where the students are weak, in which topic they are having problems. So this is the identification, and then you can develop your remedial plan according to that. Then locating the errors or weaknesses of or learning difficulties. Now, after identifying the students who need help and visualizing the necessity of additional instructional material to improve the quality of learning, the main role of a teacher is to find out the area where the learner commits mistakes or which is the area where learning difficulties lie. Then the discovery of the causal factors of slow learning. What may be the reasons? This is also a very important concern. In some cases of learning difficulties, the causal factors are relatively simple. Maybe students are not attentive in the class during teaching, or maybe committing errors due to insufficient practice or irregular attendance. So sometimes the cause is ill health or faulty work habits. So it has also been observed sometimes that the basic cause of low achievement is a feeling of helplessness or the complexity of the subject matter, which perhaps is much above the level of their comprehension. So teachers should also see how the topic is to be taught, keeping in mind the grade and the age group of the students. Now, regarding the various steps which you can see here, we start with the identification of the problem, then we plan the assessment tool, and then we have to administer the tool. Then we develop a plan or the remedial plan of action, what sort of support system is required, suggest learning materials, and then we see what changes it brings, and then the entire program is to be revised. If we find it effective, the weaknesses of the students are being removed, we can carry on or we can replan and can have the follow up of the same. Some of the important points that a teacher should keep in mind while selecting appropriate instructional material is the corrective material should be designed to correct the students' individual difficulties, and a teacher should be able to analyze the work of slow learners by means of observation, interview, and diagnostic testing. A careful consideration of this may help decide a teacher what kind of corrective material is to be designed and whether material will be adequate to correct the specific difficulties of learner. The corrective material should be graded, self-directive, and should permit students to work independently. Written directions which accompany the material should be easily readable and comprehensible by the students. The corrective material must permit individuals to progress according to their pace. The material should encourage systematic recording of evidence of pupils' progress. So, the diagnosis made on the basis of a graded test provides a definite direction to remedial teaching. The teaching learning strategy should, of course, put emphasis on exercises in the relevant area of difficulty until mastery is achieved. Further testing would be desirable to examine the impact of remedial teaching. So, this is how we have seen that what is the concept of diagnostic test and how it helps an instructor to prepare a remedial plan for the students who have specific problems in various topics in mathematics. If we consider arithmetical attainments from both a qualitative and quantitative standpoints, we can distinguish four main points: accuracy, speed of writing, methods of work, and extent of the arithmetic process mastered. It is obvious that you will try to find the feedback through the medium of classwork or through weekly or monthly tests, which indicate pupils' ability in each of the above steps, these important points described here. But it is not enough for teaching purposes, particularly with those pupils or learners who are slow learners. With this group of learners, you are required to have a more analytical estimate of their achievements. Here are some of the strategies that may be used for remedial teaching and are helpful for the students, like individual teaching. One-to-one teaching and giving instructions to individual students are very important as they can overcome the learning difficulties of the students. Direct teaching helps us a lot. There is trial and error learning. Teacher has to find out the appropriate method and strategy which may help student to overcome the particular weakness in a particular area. Skill training model, writing for reading, the multiplicity of the sense strategy, and the practice model. All these strategies can help students overcome the weaknesses that are in the field of mathematics. Along with this, hands-on activities can help students understand the concepts. So the problems shall be related with the visuals and with the pictures. Videos shall be used in order to overcome the weaknesses or to make them understand the concept of that particular topic. Taking examples from their day-to-day life is very important, which will help student to relate what exactly lies in the real life and what is there in the book. This is a very important, you can say, the strategy relating the real life with that of the textbook matter in mathematics. So all these things should be kept in mind while we develop strategies for remedial teaching, and this may change for each individual, every student's, depending on his or her learning abilities and the method which suits him. So teachers should keep in mind all this. To conclude, remedial teaching is a dynamic side of the diagnostic teaching, hence it depends on the educational diagnosis. To overcome the difficulties in learning and in acquisition of skills is the main purpose of remedial teaching. Remedial teaching is not only useful to cure the shortcomings but also in preventive measures. It is a short-term treatment and it helps the below average students to be with the normal students in acquiring the common level of achievement. The ultimate aim of is to remove the weaknesses and difficulties of students. in some emotional or physical factors are responsible for the weaknesses, then efforts should be made to eliminate these factors with the help of the concerned people. And after eliminating the factors, remedial teaching should be done. The mathematics teacher may also prepare corrective material for this purpose. Thus, by remedial teaching, the success can be achieved in removing the weaknesses of the students. See you soon in the next video. Till then, identify the slow learners in your class and make some relevant remedial strategy to overcome their weaknesses. Bye bye and stay safe.